morning, good afternoon, and good evening, everyone. As folks are joining, I'll just give a few housekeeping announcements. Please feel free to introduce yourself in the chat box to your colleagues. We see some familiar faces here and some new faces. And we ask that you please remain on mute during the presentations, but you are welcome to put your questions in the chat box as they come up. And during the discussion portion, everyone is encouraged to raise your hand using the Zoom function in the bottom right corner of your Zoom screen, and then the moderator will call on you. This session is being recorded, and we will also be able to share any slides that are presented with everyone who registered after the call. If you have any sort of technical difficulties during the session, feel free to message me on Zoom. So with that, I will hand over to Dinez.
Thank you, Sita. My name is Dinez Kasungami from the Child Health Secretariat Task Force. And I am pleased that together with the ORSZCA Co-chair Alliance, we are hosting this meeting to launch the Alliance. Just briefly, the task force is a network of stakeholders in child health. We have more than 2,200 members from 80 countries, more than 80 countries and more than 300 organizations. The goal of the task force is to strengthen equitable, comprehensive child health programs focused on primary healthcare platform inclusive of community health in line with the global strategy for women's, children's and adolescents' health. And in that light, we partner today to launch the Alliance because children continue to die from diarrhea, and these are preventable deaths. And this is an opportunity to increase access to and the utilization of zinc and ORS, which we know is an effective intervention for diarrhea. And the evidence will be presented as we continue in this meeting. So I hope we will all take this as an opportunity to join hands together to prevent these unnecessary deaths of children. I also have the honor to introduce the two co-chairs of the Alliance that is being launched today. The first co-chair, Dr. Morseda Chowdhury, is the Director of Health, Nutrition and Population in BRAC, which we know is the largest non-governmental healthcare organization in Bangladesh. Dr. Morseda has more than 20 years of public health experience, focused on project management and strategic research, focusing on reproductive health, nutrition, communicable and non-communicable diseases using the community-based platform. And as co-chair of this alliance, she brings insight of practical ground level realities of nationwide programming, academic research, and advocacy with governments. And we know that the experience and skills will be valuable to the success of the alliance and the saving of children. A second co-chair for the alliance is Sami Amar. Sami is the head of health at Save the Children UK, leading a global portfolio of maternal, newborn, and child health programs in 20 countries. Sami has more than 14 years of experience in international health, focusing on global health, and evidence-based programming. His team has partnered with renowned world research institutions to expand the global knowledge base and also provide evidence around the cost effectiveness of the 7-point diarrhea control strategy that we don't hear much about. And this experience has been gathered in India and Nigeria. And that experience will also be relevant to the success of the Alliance and ending of these preventable deaths in children. So with that, I now hand over to Morseda to lead us into the next part of this launch. Over to you, Morseda.
Thank you, Dinus, for your nice and warm introduction. First of all, I'd like to thank Child Health Task Force for hosting this launching of the ORSZCA Co-Alliance, COPAC Alliance. This is indeed a great endorsement of initiative that is aiming to solve a problem that could save hundreds and thousands of children's lives worldwide. So this is a common goal that we are all aiming for. So let me run you through the program that we are going to have today. First of all, we have 3 very eminent speakers among us. We are very lucky to have them among us, and we will listen to them in past 15 minutes or so, followed by remarks or responses from global eminent panelists from different global health agencies. That event will be also 15 minutes or so, and then Dr. Sami Amar, another co-chair, will share the work plan of the ORSZCA COPAC Alliance. And next, we will open the floor for the audience today who have joined with us, and they can ask questions to the speakers and to the panelists. After that, Sami will close the program, thanking everyone. So that is in a nutshell how we are going to run the program. So now the next episode, without any particular order, let me introduce Professor Robert Black, a veteran epidemiologist and professor at Johns Hopkins University, Bloomberg School of Public Health, Department of International Health. He is a leading expert on prevention of childhood mortality and diseases, especially diarrheal diseases in low and middle income countries. His studies in Bangladesh, India, Peru, Zanzibar demonstrated that daily zinc supplementation significantly reduced the severity of diarrhea and pneumonia. These discoveries led WHO and UNICEF to recommend the global use of zinc for treatment of diarrhea, which has now been implemented in many low-income countries. Professor Black, the floor is yours.